welcome back. We have been joined on set for our first conversation this morning by the Minister of Health and Wellness, none other than Kevin Bernard. Good morning.
Good morning, Isani. Good morning, April. And it's a privilege to be here once again. And I think the last time we did appear, it was virtually.
Yes.
We're in Taiwan, I think. But definitely, it's a privilege for me to be here this morning.
So, discussing issues related to public health, management, administration, and what have you. My first question for you would be the biggest challenge that the system is facing, and perhaps what the government of Belize is doing to be able to address some of these issues through your ministry.
Let me first of all start off, Isani and April, to thank all those persons working in the Ministry of Health and Wellness. I won't call names because there are so many of them across the spectrum of the regions and even at the ministry level. But you raise a very valid question in terms of what are some of the major challenges. There are a few challenges. As you know, when I took over this ministry just about a year ago, a little over a year now, in January of last year, we were really still in the middle of a pandemic. There were major issues with the supply chain that has been disrupted, caused by external factors and internal factors. I would say that compounded the challenges in terms of medication shortages and so forth. Things that we feel that we had to quickly address and try to find remedy for. And I know that over especially the latter part of last year, where we had the KHMH workers union, the nurses walking out in certain issues, and that was one of the biggest cry. But like we have said to them when I was meeting with every one of these regions, is that we've been working on the challenges that we faced there. So that is one of the big challenge. But at the same time, we do have another big challenge: infrastructure. We need to really take a look at what is happening. I know there has been an assessment done for all of our facilities countrywide. KHMH, let's look at KHMH. Even though KHMH is a statutory body, and we as a regulator, we need to still make sure that KHMH is functioning the right way. The infrastructure at KHMH really need an overhaul. I know there's great plans through the board in trying to come up with some initiative, whether to raise a bond or seek financing somewhere else, whether local financing or through government support, through grant funding, to try and see how we could really upgrade KHMH. For quite too long, KHMH has been operating without a CT scan. So we're right now in the process in getting that CT scan for KHMH. We have been in discussion with a group in Taiwan, where as well they are going to be donating an MRI machine, which will be placed at KHMH as well. I haven't shared this with the board, but this is something that my CEO have been working very arduously behind the scenes in communications, and we have made great strides in getting that commitment to have that done. But the Western Regional Hospital, we just recently inaugurated the polyclinic, but there is need, when you look at the infrastructure countrywide, for us to really look at that as well. So apart from the supplies issue that we had, the infrastructure issues that we have, there's also another major factors that contributes to a lot of the strain that many doctors and nurses and the frontline workers faces, is the fact that we're losing our human resources.
Yes.
Perhaps that's the biggest challenge.
Yes, and that's one of the biggest challenges. That's what I was going to say. Yeah. That's one of the biggest challenge. No matter how many advertisements we have placed out there, and my CEO and our directors, they have been on the ball saying, anybody who applies and they meet the criteria, let us ensure that we can push for. We're not looking at your political colors, whatever. That is not the business of the Ministry of Health. It's people health we're talking about, and the human resource shortages that we have at this point put a big strain on everybody.
I really wanted to, I'm glad you brought that up, because I believe that the University of Belize just had a cohort of nurses that,
Yes.
that graduated.
Right.
And so with that being said then, Minister, what do you think is the problem? And then I'll go a step further to say that there are a lot of students that graduate with biochem degrees, med lab degrees, nursing degrees. They don't want to work here in Belize. Is it a marketing issue? What is the issue?
Well, I don't think it's a matter of marketing. It's where the remuneration is, and let's be frank and real. In the public service, it's not attractive. You know, we have nurses going out in the UK, in the United States, because they are very great packages. And that's the discussion we've been having, both at the national level, at the cabinet, at the government level. When you look at, and it's not only the Ministry of Health, but when you look at specialized engineers, for example, in the Ministry of Infrastructure Development, it's difficult to really get qualified individuals that fit the criteria. And similarly, our doctors and nurses, a lot of them come out from these institutions and they prefer go and work in the private sector as opposed to the public sector. But that's a big discussion that has to happen because when you look at the whole salary package in the public service, an entrant coming into government, the salary is not attractive enough, so people kind of weigh that option. And it's not just nurses and doctors. You're talking about these technicians, all of these persons that work in the lab, for example, pharmacists. You know how difficult it is for us to attract a pharmacist to come into the public system to work. To retain them is another issue. So we have to look at the whole picture. And so what we're doing...
Let me argue from a somewhat philosophical point of view here. You guys are the government. You guys control the public purse. In much the same way that you go through a fiscal exercise annually to determine how the monies will be spent by ministry, can't it be such that you look at the public service, for instance, and seek to compensate the people who are, one, aptly qualified, two, who have years of service and experience, because not all of them would have paper and qualifications to say this is what they've mastered in or what have you, but some are there who, by way of experience, are equally knowledgeable. Why can't it be looked at from that point of view? Because I'm saying that to say this: for you guys to be able to attract persons to join the public service, what you offer should be equally as attractive. And the idea has always been that there is more money to be made in private practice than it is to join government.
One of the things, Isani, which is critical, as you know, the wage bill is very heavy. Government pays a huge amount of the revenues that come in, goes right back to salaries and so forth to cover the wage bill. So there's always a very, very, very tough balancing act that has to be made in terms of the delivery of service that we have to offer as government, and at the same time retaining those in employment. But that's a discussion. If you ask me on a personal basis, I would make some tough decisions. But we have to also focus on the persons who are employed. I mean, these people have families. But yes, I think that discussions have been going on in terms of when we look at the whole public service and the whole constitution reform that that a consultation will start to take place on. All of these things have to be taken into consideration. And it's not to say that doctors or nurses or anybody else is better than any other employee within the government system. Everybody have a function to operate in. But I think that we really need to sit down and take a hard look at the whole public service structure, how it works and all of that. From the grandfathering principle that exists, that also, for me, I believe that also has to change. People has to be given the opportunity by merit as opposed to just because you were there 10, 15, 20 years sitting down, not trying to advance yourself, and you just climb the ladder. That's my personal opinion. But that's like I said, that is a discussion. But so that creates a lot of strain on our ministry and all ministries when you're trying to attract people to come into the ministry to work in these things. But there's a lot of other great things too that has happened in the ministry, Isani and April, and I think that it needs to be highlighted. But COVID has, I mean, and I hate to bring up COVID over and over, but it created a whole problem and continues to had its effect. But where are we going? Where are we going as a ministry, and what are our focus? Our focus is to try and now tackle those NCDs that are affecting our people: diabetes, hypertension, obesity, cancer,
heart disease.
and I have some very important things I would want to discuss in terms of cancer later on, and I'm sure we could touch it, that we feel that has to be brought to the forefront. I mean, when you talk about HIV/AIDS, for example, there's a specific program targeted to focus on HIV, and we have seen where there has been a decline in some of these areas. Early mortality in terms of parent to child, that has the transmission rate has dropped. So there's a lot of input that's been done in terms of those areas. So I think that cancer is another area that needs to be given more priority. A lot of our people are dying from cancer at very young age. Young children now are dying from cancer. This young man in San Felipe, very young fella in the young 30s, just recently passed away because of cancer. So we have to come up with some program in terms of how are we going to address cancer as a ministry, and not just to focus on. I know we have the Cancer Society that try to make sure that they get things, but I think the ministry now needs to take a full control and put a solid program in place, get the fight for the budgetary support, so that there's a line item there in the budget that will have cancer control program listed, and we have the support and look at all the things that needs to be done to control, mitigate, prevent, educate as well on the effects of cancer and how we could fix that. But as I said, there have been great things happening over the past year. I mean, look at the Belmopan Polyclinic, for example, in trying to focusing and putting our energies in improving primary care. We look at the now San Pedro hospital that will be constructed. We are talking about a new pediatric wing for the Northern Regional Hospital. We are working closely with Rotary Club of Belize in Orange Walk in terms of how we will partner to build that pediatric.
There was also a recent NHI consultation.
Right. Yes, and NHI, and I was going to get to that. NHI has been one of the biggest agenda for the government and the rollout of NHI. We just last week, I know the NHI team had their consultation as well, and the Orange Walk district will be rolled out pretty soon. But it's our hope that we can get the rollout of NHI countrywide over the next few years. That will bring benefits to all our Belizean people. I mean, when Orange Walk is launched, and when we target the amount of person, I understand that we want to target another 58 to 60,000 Belizeans in Orange Walk district. That will take us to a coverage of almost 268,000 Belizeans that will benefit from NHI.
However, NHI only covers, it's only a limitation of coverage for now,
yes, and that's why, and this is the reason why, because NHI tries to focus on the primary care. And so to reduce the strain that goes to the regional facilities and to our tertiary hospital. And this is why we are saying that we put efforts on primary care. And that doesn't only mean the polyclinics. We need to do more for our communities. So our community health centers, we are looking at our community health centers. We just upgraded the Georgeville Community Center. Pretty soon we launch. I was able to, as a minister, as the area representative, let me take up my hat as Minister of Health, but as the area representative, I was able to also lobby with the BTB for us to get a health clinic in Santa Marta, for example. And so through the ministry, we will be inaugurating that health clinic, that health center pretty soon. And we have to look at the Chan Chen there. For example, Chan Chen village complains that, you know, the health center needs to be looked at. And across the country, we have to really sit down and look at our health centers within the community level.
So then maybe Minister, that might be one of the ways to sell for human resources. And I say that because when people look at public health or health in general, they look at Belize City KHMH or Belmopan Western Regional, when there are all of these other health facilities that you are not just inaugurating, but would require the services of persons to work in them, right?
No, of course. And one of the things that when speaking to our directors, one great thing I can tell you, I think I have a wonderful team of directors and my CEO. We have a very great working relationship, and that's what I said when I took over this ministry, that we're going to build a team that is going to be focused. Vision has to be there to ensure that we could improve health services across this country. We're going to work closely with the team at NHI. So yes, we have to look at the nurse to patient ratio. We need to look at the doctor to patient ratio. So there is need for us and this is when I spoke earlier about the challenges. We have to ensure that we can attract these people to come to work in the public service system. We have recently, in fact, countrywide, I think there's over 260 something community health workers, and we want to expand that community health worker program so we could provide much more coverage. And I want to thank them too, because many people, sometimes those are the unsung heroes you don't hear about. These
in
are
many instances they are the unsung.
Yes, exactly, and they're the ones who are the first responder that goes and visit the diabetic patient in their home and making sure that, you know what, you're getting your medication to time. So these are things that we have to really look at and improve. Now, I mentioned earlier as well, and I always say this, I always take challenges and turn them into opportunities to improve. And so one of the challenges we saw in terms of the whole supply management and distribution, the shortages of medication that occurred, and again, like I said, some factors were external, and I won't be here to pinpoint on anybody or any issues, but we're here to find solution to the problem. And so that's the reason why late last year I took a paper to cabinet how we're going to fix this process. We feel that we now we have identified those areas that needed improvements, and so with the new tender cycle we should see major improvements in terms of the time we sign contracts, the time it takes for deliveries, but at the same time, how are we going to enhance the delivery of the supplies and medications to the regions, to KHMH, and making sure that there's proper accountability and all of these things.
Well, there's also quality assurance too.
Of course. So one of the things we have done, let me point out one of the things. At CMS, for example, the Central Medical Store, as you know, currently the Central Medical Store does not house all the medication. Suppliers have to house some of these things, and then requisitions are made to the supplier to distribute. We want to change that too. But to have strengthened the Central Medical Store, we also brought in 2 pharmacists in the Central Medical Store to ensure, one, we are looking at quality assurances and so forth. We have also ensured that we hired a drug inspectorate, a senior drug inspectorate that manages that unit. A wonderful doctor, very well educated, well versed in what they want to do. And so we have now our inspection unit going out, doing their job, making sure that suppliers are being monitored, that making sure that they go into the regions and do spot checks. So these are the instructions given to the units. So what do we do to also enhance that? Our plan in this next year, next fiscal year, is to really now start to ensure that instead of having warehouses all over the place to house medication, set up one state-of-the-art central medical store with a proper inventory system. Currently, the BHIS system is used to monitor some form of a level of inventory. I personally, coming from a private sector where I dealt with systems and audit and so forth, I feel that we needed to bring a different setup for managing the entire inventory of our pharmaceutical and medical supplies. And so we have agreed that going into this new fiscal year, we're going to be putting our efforts to ensure that, one, we get that central medical store built, but we also need to put a proper inventory system across the country that can be tracked and monitored, and also linked with our polyclinics that works along with NHI, because you know NHI uses a different system. So we're trying to ensure that we can do that through PAHO. There's a CDIP software that is being built that will communicate with BHIS and RAWA. So that is more from a clinical data information that we'll be able to share within. You go to, for example, you go to Belmopan Polyclinic, you are able to access your records in Orangewa, because you want to be able to. This, of course, the privacy and all these things will be embedded in this program. But that's one of the areas that we want to see also improved at the Ministry of Health. As I mentioned, the regions, the Western Region Hospital, we need to look at the upgrading Western Region Hospital. But talking about hospitals, as you know, I had mentioned this in one of my interviews before, that through CABE, we have been doing a feasibility study that will identify at least 5 major hospitals that can be built as well. One of them being a new referral hospital in the Belmopan city. Critical. Just yesterday, Minister Habet was sharing with me that he feels that the San Ignacio Community Hospital has the population in that area that it covers, Benke, San Ignacio Tong, Santa Elena, the population has outgrown the needs for a community hospital, and so there is need for us to really take a hard look, and that's one of the areas that we are focusing in terms of the Cabe, Dangriga, the Punta Gorda area, you know, and again in Orangewa. So we could look at how we can improve the services.
Let me segue for a second here. You're on the heels of a 2-day retreat where Cabinet met to discuss a range of issues going forward, and health is one of the huge areas of responsibility for the government of Belize. From your end, what came out of that meeting?
Well, we had a very robust discussion at Cabinet at retreat, and everybody was able to express openly in their areas that what we feel that we need to be doing. And of course, in terms of health, health is always a priority. While health may not have been a direct targeted point of program on the agenda, it was part of the discussion, because every person who got up spoke about some issue related to health. And so it is a given fact that one of our key priorities, education, health, growing the economy, making sure that we put people back to work, making sure that you know, we have better increase the housing program, making sure that there is access to adequate health care. And so that is the reason why we're talking about the NHI rollout, how we're going to find the money, what mechanism we're going to put in place, whether it is that are we going to be putting out I mean, the proposal, there are several proposals on the table that we are looking at. If we ever take over the Bolido, do we put those funds to program NHI, or do we look at a syntax that will be able to go geared towards NHI, as again, improving primary health care in our country is critically important to our government, and to ensure that we can be able to reduce the effects that we have in terms of all of these issues that they talk about, or the NCDs that are affecting our people.
I want to take the conversation a little step further when it comes to where we are in our society with health. And recently, well, not just recently, but for the past few months, we've seen another wave of COVID. And regardless of that wave, we've not been seeing an improvement on vaccination intake. can you give us a synopsis of where we are in terms of the vaccination management for COVID, and if there is a target that you're trying to meet?
One of the things that we said just literally mid last year, I believe it was in June, July. As you know, the government spent a lot of money acquiring vaccines. Some were donated, and we tried and we pumped as much campaign into our vaccine campaign, making sure we try to encourage people to get vaccinated. We still have our target set. We would have hoped that we would have achieved that 75% overall population target by September of last year. We haven't reached there. But when you look at the region, and that's one of the things that I always try to say, is that it's not to look at the glass half empty or so, but to let us look at what has happened in the region. When you look at Belize compared to the Central American region, including our Caribbean brothers, we are at a much more better rate in terms of vaccination when it comes to the overall population. Or when you look at the targeted population, the 5 and above, we were at a very reasonable percentage, but we still encourage people to get vaccinated. Now, when I had this discussion with Dr. Baer and some of our colleagues, I said, I think we have reached the stage where now it's your responsibility. Government cannot continue to be investing in so many vaccines and then it expires and then we have to dispose of them. Those are money wasted. So with what we have, we are trying to still encourage people to get vaccinated. We are still working in trying to get access, whether through donations for some Pfizer vaccines for the 5 to 11, because you're aware we don't have those vaccines in country at this point. So we are still optimistic that we can get there, hopefully by mid-year, to get to our 75% target population. And if we do that, then I'm sure we will be satisfied that we have done our very best to encourage. There are still the naysayers out there. There are still those persons skeptical. I mean, despite the many documentations and material that you could grab off social media. Not everything that's on social media also are sometimes legitimate. You know, sometimes there are things that scare tactics out there to discourage people to. But the ministry, through our vaccination program, has been pushing very much the agenda. As you notice, that has never stopped. But at the same time, our other focus is on the other immunization.
Right.
During COVID, and it's a global issue, UNICEF also took out a report on that we in Belize we had a 90-something% vaccination for all of our other vaccines. Those fell almost down to 72-75%. We are now working very hard through our community health workers, through our vaccine program, to get that back to that percentage where we want to take that back to 95, 96, if we can, possibly 100%.
What would you attribute that to? Because on one end, one could say, well, perhaps the ministry shifted focus from the MMRs to deal with COVID directly as the clear and present danger, in a manner of speaking, right? So you shifted focus there. What would you say led to that? Because it's easy to say that, but on the other end, people may have simply lost interest in vaccines.
Well, I wouldn't say that they may have lost interest in vaccines. It was the fear that people had in accessing the hospitals, accessing our clinics, because of the fear that they go and catch COVID. And like what I said, UNICEF did a study of the region, and it's worldwide, across the board, that they saw that. And you know, interestingly, when we had the UNICEF representative here a few months ago, and she said to me, she said, Belize was at the top. He said, we want to get there. And I told her, we will get there. We have a very hard-working leader in that unit. That lady works so hard that sometimes, you know, my CEO will say, I wonder if they ever ever rest, you know. But this is the kind of commitment that I'm saying that at every level we have across the ministry, and that's why I really appreciate the work that the people do there. But we are putting our very efforts to ensure that we can achieve these objectives, Isani and April. It's critical for me to point out that there are, like I said, one of the things that we're trying to ensure that we could also fix and improve is mental health.
Yes.
There is a policy that we are working on, and we are working closely with the Ministry of Human Development to address the mental health issue in this country. It's a big priority for us as well. You know, a lot of people talk about it, and people think that, mental health is just those persons you see walking on the street, looking lost. It's not that. There are people in your workplace, there are people sitting right next to us sometimes that you don't know what's going on
they're
inside.
battling depression, they're battling all different kinds
I just got a call last week when I was driving down to Belmopan. A good friend of mine who said, you know what, I suffer depression. And I said, I did not know you were going through that. You know, and so these are things that we don't know, but our ministry is working on that nutrition policy. We're working on strengthening the nutrition policy in Belize. We have to really start to look at what we're eating, our habits, and this is one reason why at the next cabinet I'm taking the paper to cabinet to talk about the sugary food and drinks in schools. You know, we have to seriously address these things. If we are going
I'm glad you use the word seriously, Minister, because in all honesty, we've been hearing about this for quite some time. It hasn't really picked up traction in terms of meaningful action behind it, but this conversation has been around for some time.
Yes, the conversation has been along for a long time, as you're right when you say that, but now we are taking the action. Just as I have said, we need to take action in terms of cancer control. We have to ensure that we are addressing these issues head on. We cannot just simply be putting out policies and having them shelved. We need to see action, we need to see results, and the only way you will know that things are working if the figures are showing. If there's decline in cancer deaths, if there's decline in child mortality, if there's decline in the diabetes, people dying from diabetes. So those are the things that we are talking about as a government, as a Ministry of Health. And like I said, the commitment that is there by our directors, our lead teams, our technical people that are working on the ground, making sure that these things are being focused. Adolescent care. We're talking about the school feeding program, working closely with the Ministry of Education, and that's why I mentioned about that sugar and sweetened drinks that we have to really sit on. And I want to applaud Bowen and Coca-Cola on a whole for also saying that they are fully pulling out the soft drinks, of sale of soft drinks within the primary schools. But we have to look at another wider picture of all of these things. I know through Dr. Musa, they are working on a Hearts initiative, and it has its own acronym, but it's all about addressing non-communicable diseases, prevention, care, and all of these issues. So maternal and child health is another issue where I know Dr. Bear, that's her baby, and again, she's another passionate, hard-working lady that moves that unit to make sure that, one, we need to make sure that we look at protocols, standardized protocols across the region, across the country, improving these things. If we don't put these things in place, Isani and April, we're not going to go anywhere. And so that's one of the vision we have in terms of making sure we can do that. I mentioned earlier as well in terms of the whole process of procurement, strengthening that process, making sure it's more effective, more accountable, and like I said, I always say, we don't go into government thinking that we have all the answers. As the Minister of Health, I have to rely on our technical people to make guide us to make the right decisions, so that when I take something to cabinet, I'm taking something that has solid basis, and it's evidence proven that we can make the right decision.
It's interesting you'd say that, Minister, because just about a year ago, you were moved into the Ministry of Health, and notwithstanding the issue at the time, which was COVID, for you it was baptism by fire, right? Because you're coming.
The last time I used the perfect storm, I got myself in a little bit of trouble.
I call it baptism by fire because you were thrown into the middle of a crisis situation that you had to learn how to manage in short order. Right? Reflect back on what that has been like. A year later, you know, at the helm of the Ministry of Health and Wellness, and we're going in a particular direction, notwithstanding some of the everyday challenges.
When I was last week sitting down, and I said, it's been a year I'm in this position. When January 10th hit, right? You know, and I said, wow, a year already. Went so fast. But yes, I mean, when I got into the ministry, it's all new. You know, I was already comfortable in e-governance and making some amends in the Ministry of Youth, and I'm happy that Minister Ferguson has continued the youth side, and Minister Shebat with his team has continued in pushing e-governance. But I had to now take on the role of Minister of Health and Wellness, and so I said, well, let's get into this thing, and I will use my own example. I've always said, when I get into any job, I make it my priority to understand the scope of the work, to work along with people, to get advice, to listen to advice. I don't have all the answers. I won't never have all the answers. But from a managerial perspective, somebody who have the experience in terms of coming from the private sector, that type of, I have always said we need to change the way we operate in government. Come and try put the private sector mentality within the public service system. And so that's how I started. Build your team. I made a commitment, we have to find or fill these gaps for these critical posts within 3 months. We did that. After that, we had to then again, because we're now filling those gaps, now let's plan, let's see what it is that we need to achieve. We countered the issue with medication shortages, the whole supply disruption and so forth. We had to walk through that stormy water, as I would say. And we have been able to come out breathing. That I feel that over that year, it's a learning curve. It was a learning curve for me. That today, I can sit here and talk about these things, and can proudly say that we are making the right, we are on the right step, right direction, and that's why we know now what is it that we want as a ministry. Now, one of the things that I want to also point out, when we talk about NHI, I forgot to also mention that as a ministry, working together with the NHI, we are working on the whole revision of our health policy. There is a need for health reform, and we need to focus on how is it that we're going to really manage the entire health sector in Belize. Is it going to continue the same way, or do we find different methods of how it will apply? And that is what we are working on right now. And that part of that discussion will commence in, I have a steering committee meeting that I'm setting up right here next week, so we could start that and start to explain to people, get stakeholders involved. The private sector plays a critical role in terms of how we want to reform the health sector in Belize. And so these are things that we've been working. So when I look back and I say January 2021, January 10th, 2021, it was like, wow, what am I getting myself into? But now when I look back at it, I'm saying, well, you know what? It's not that bad of a job. It's just
Being
about working together with people, making sure that you're listening. We have to listen. As leaders, we have to listen. Once you listen, and you know, just listen to the ones that want to make you hear what you want to hear. Listen to those right down there that you're seeing, telling you, you know what, this is a challenge we're having. This is what we are facing. I get texts every day from various parts of the country, persons in various level, and explaining to sometimes the domestic, they send me an e-message, you know, Minister, we need to improve this, blah, blah, blah. And I not just take that and read it. I take that and try to take action immediately because you know what, when we need to try to address something, I got a concern here, let's look into the concern.
Yeah.
You know.
As we are wrapping up, Minister, final thoughts. Since you were, as Sani mentioned, thrown into the fire, coming from somebody that's not from the health sector, what is the one thing that you learned? One thing that you never know. Just one, because we're done out of time. One thing that you learned from all of these various stakeholders that you say give you advice. The one thing you learned.
What I could say. What I was. It's a tough thing to answer that question in one thing. Just that it's very dynamic, I can say.
Yeah.
It's very dynamic, and it's a lot of opinions. You will get a lot of opinions, but again, for me, it's about being the leader in the ministry that will not take anything as criticism, but as positives. You'll never hear me railing up with the media when they attack me about issues that I feel is not directly related to me, but I'm there to listen, and I take those things and say, what, let's sit down and reflect and say, what are we going to do to fix that? Let's fix that perception, because it's not what we're trying to do. It's not what we're trying to achieve at the ministry. And that's why I wish I could have gone over and said all the things that we're doing in terms of improving radiology and all of these things. But at the end of the day, it's about improving primary care, it's about improving our secondary care, and it's about making sure that our tertiary hospital is up to par. I know there's a lot of work that has to be done. We need to ensure, but as the minister, it is my goal to ensure that when you look back 5 years from now, when you look back 10 years from now, I could say, you know what, I made an impact.
Wonderful.
I made an impact at the Ministry of Health, and that's why cancer control program is one of the main things that I would really want to push. I really want to see, and our directors and we have in the same page. We're saying we have to ensure that our NCDs are focused. We focus on those issues, we address those issues, and with the rollout of NHI. And of course, yes, the human resource issue, we have to fix that.
Right.
We have to try and improve that, that we can address these issues. Because without human resources,
You don't really have much
really
going on.
much that we
But
can do.
Minister Kevin Bernard from the Ministry of Health and Wellness, thank you so much for coming in. We appreciate. I mean, like we said, we continue this conversation all day, but we do have to go. But we thank you so much for your
Can
time.
I add one last thing before we end?
Certainly.
Before I end, I want to thank the team at the Vector Control Unit as well. You know that Belize is about to be declared malaria-free.
Malaria-free,
And
yes.
just as how we are about to be declared malaria-free, that's why I'm mentioning already, and I stress on cancer, but we need to also ensure that we're reducing all of those other issues across the country. But thank you very much for having me. It has been a privilege. And if we were to discuss the notes that I think that we wanted to discuss, we'll be here.
We'll be here all day. We'll be here all day. Thank you
Once
so
again, thank you very much for having me.
And with that, we are going to take a short break. We'll be back with the representatives from the Taiwan Embassy here in Belize to talk about the Lunar New Year. Stay tuned.